Good morning, everybody. My name is Jacob Brumfield, and I am the unit manager on the Cardiac Intermediate Medical Unit at Lynchburg General Hospital through Centra Health. Today, I'm here to talk about my strategic plan overview, proposal for the hospital, which is looking at the expansion of technology at Centra Health. To kick us off, I do want to talk a little bit about objectives from this presentation. We're going to kick off with looking at a review of the mission of the organization, so what the organization stands for and is seeking. We're also going to review organizational opportunities, look at proposed solutions to those opportunities that the organization is faced with. We are also going to review the strategic map and goals that is being suggested in this proposal. We're going to review implementation, review control methods and evaluation of the project, as well as summarize this presentation at the end. So to start off, to talk a little bit about Centra Health, the mission statement of this organization is excellent care for life. The vision is to be the most trusted provider of innovative healthcare, and then the values is in a spectrum, has three pieces, which is all around patient-centeredness, is integrity and respect, teamwork, and drive for excellence. So this organization really looks at how do we work together to seek excellent care that is trustworthy and really centered around the patients. So all of our strategic map will be based around those principles. As we move forward in this presentation, we're going to talk a little bit about opportunities. Some of the opportunities for Centra Health that has been identified was underutilization of technology resources. Currently, the facility has a lot of different resources for technology, but they're not all being utilized appropriately. Lack of communication standardization. So current state, there are multiple modes of communication, which can be a good thing when looking at getting updates out to the organization. However, with the lack of standardization, this can sometimes become cluttered. Another opportunity is technology needed for competitive advantage. As we move forward in a digital age and technology expands, we need to keep up with the times to be able to compete with our competitors to give us that edge against them when competing for patients. Another opportunity is living up to the vision of innovation. So as we listed that we want to be the most trusted provider in innovative healthcare, that innovation, this is an opportunity for us to expand on what we do. And then lastly, an opportunity is to provide optimal patient outcomes and expand preventive care. By using and expanding technology, we have an opportunity to really touch base with people to both prevent illness, but also provide better care when they come into our healthcare facility. So the proposed solution here for this strategy implementation is the utilization of Microsoft technology as a standard mode of communication and project management for the organization by the end of this calendar year. The strategy map that has been developed for this project outlines different goals that are leading us towards this strategy. They look at the four different perspectives when looking at this topic of strategy implementation. So looking at our learning and growth goals through this strategy map, we have optimizing current technology resources, promote staff utilization via training, tech communication with patients. When we look at our internal business process goals, we are seeking to increase efficiency and accuracy of care, standardizing modes of communication, focus on preventative health care. When we move on to our financial performance goals, we want to receive higher rates of reimbursement, better management of internal costs, and lower patient healthcare costs. And finally, in our customer service goals, we have achieve quality healthcare outcomes, produce organized and competitive care, and increase the health of our community. All of these are goals and are all accomplishable through expanding with Microsoft technology, specifically the Teams platform, in order for us to communicate, collaborate, and work better together. So how are we going to do this? Some of the strategies that we are looking at to implement this strategy are using management by objectives. So the management by objective, or MBO strategy, is a way for us as leaders as well as the frontline staff to work together to establish set goals and standards of what we are seeking. This will allow for the frontline to be more involved in decision making and allow for more buy-in and commitment from the frontline and ensure that we have success in the end. The other strategy is that we're going to look at innovation. As we no, technology is something that is very innovative in itself, but looking at how we best use it, we will need to rely on tech savvy or training change agents to be very savvy with the technology and looking at what are the best uses and the best ways to standardize across the organization. Some of the tactics, we are going to rely heavily on Kotter's change management tactics, specifically looking at urgency, communication, empowering action, and short-term goals. We will need to establish urgency so that the organization understands why the change is needed. We'll need to communicate frequently and specifically so that they understand what are the strategies, what are the goals, and which direction is the organization heading. We'll need to empower action so that they feel inclined to be able to be a part of the change process and driving strategy for the organization and understanding how their role really plays a major part in success. And lastly, we need to set up short-term goals. We're going to have to establish, rather than saying this is where we're going to be in 2 years, we need to understand, is it a month, is it 3 months, and saying these are attainable goals so that we maintain motivation among staff and as an organization. As we talk about control and evaluation of this project, we're going to be using decentralized and feedback methods for control of achieving success. Decentralized to just really correlate with MBO strategies and being able to give the front line more of that feedback into developing this strategy and moving forward with the project. It will rely heavily on the culture and us having a set agreement on being able to accomplish this. With looking at feedback, this will be a way for leaders to say, yes, we do want you to be at the front line making these decisions and really driving strategy. However, we need to be able to evaluate those outcomes and say, yes, what you're innovating is working and moving the strategy forward with Microsoft technology. Evaluation for success will be based off of 4 different perspectives. One will be utilization rates. We want to make sure that the organization is actually using the technology. Is this something that's being used day to day for our work in order to better outcomes, better communicate, and collaborate? Another outcome measurement will be patient outcomes. So looking, are our patient scores better for their, not only in the hospital stay, but are we preventing their outcomes as well? Looking at the third is cost reductions. We want to make sure that there's a financial savings for the patient. And then lastly, staff feedback. We want to understand that the staff, this does make their workflow better and makes us more efficient. So in summary, Central Health does have an opportunity here to utilize our technology that we already have available to us, but to standardize it as a mode of communication and collaboration. Microsoft Teams, it does connect if we utilize this strategy map to be able to connect to our mission and vision and values in order to work together as a team for excellent care for life. And then implementation, again, as a review, looking at using management by objectives, innovation, and engagement of the team in order to drive this strategy throughout the organization and to see success. Success will be driven also by control with feedback and decentralized methods, and the evaluation will be taking place through the 4 different components, both financial, utilization rates, patient outcomes, and staff feedback. Thank you for your time and appreciate any and all questions for this presentation, and I look forward to working with the organization and the implementation of this strategy. Thank you.